Please ensure that your microphone is muted throughout the session. If you have questions during the talk, you may type them in the chat box. And the Q&A session will be conducted at the end of the presentation. Ladies and gentlemen, before I continue my talk, I am Dr. Nurhida from one of the committee in the Malaysian Anatomical Association, and I just want to reintroduce to you again what is this ARNS. The ARNS stands for Anatomy Research Network Series. It is an initiative by the Malaysian Anatomical Association to provide a platform for anatomists and researchers to share their work, experiences, and collaboration across institutions and countries. Throughout this series, we hope to strengthen the research networking, encourage interdisciplinary collaboration, and inspire new ideas within the anatomical sciences community. Today's session also provide one MMA CPD points for participant who is having MMC registration. Please register using the registration form via the link provided in the chat box. And it is now my great honor to introduce our distinguished speaker for today. She is Associate Professor Dr. Choi Kerwoon from the Department of Anatomy, Faculty of Medicine, University Technology Mara, UiTM Sungai Buloh campus. Associate Professor Dr. Choi obtained her PhD from the University of Malaya in 2018 and her Master of Medical Science in Anatomy from UKM. Her research focuses on several exciting areas within anatomical sciences, including forensic anthropology, geometric morphometry, radiological anatomy, artificial intelligence in anatomy, and also anatomy education. Associate Professor Dr. Choi has an impressive research profile with more than 1,200 citations, with hash index of 18 and over 70 scholarly publications in index journal. In addition, she recently served as a visiting research fellow at the Center of Forensic Anthropology, University of Western Australia in 2025. This further expanding her international collaboration in forensic anthropology research. And throughout her career, she has received numerous research awards, innovation awards, and best presentation awards, reflecting her strong contributions to both research and anatomy education. Today, she will be sharing insight from her international academic experiences in Australia, Italy, and Thailand, particularly in relation to anatomy and anthropology research collaboration. Okay, without further delay, it is my great pleasure to invite Dr. Choi to deliver her talk. And Dr. Choi, the floor is yours.
Thank you so much, Dr. Hida. Please allow me to share the screen first. All right. Can you see the screen?
Yes, we can see the screen.
All right. Good morning, everyone. Thank you so much to Malaysian Anatomical Associations for the kind invitations. And today I would like to humbly share my journey in anatomy and anthropology by having the experience from Australia, Italy, and Thailand. So this is my infographic CV as has been introduced. My research niche is very much focused on forensic anthropology and radiology. And yeah, so there are some of my experiences that I hope to inspire everyone as well. So I would like to share that bones are more than just anatomical structures. So within our lectures, we commonly introduce bones, apply anatomy of bones in relations to injury, disease, diagnosis, and some medical procedure. But there are one subfield of the bones or osteology that is in the heat now, which is anthropology. So what is the relations of anatomy and anthropology? So anthropology is very much focused on the biological and skeletal aspects of the human, for example, human evolution. So what are the differences of bones 500 years ago and now? So what are the skeletal variations between populations? Is our skeletal features among Malaysians, are they different from Australian and African? Yes, there are differences. The growth and the development, what are the osteological changes throughout the growth and the developments? And what are the adaptive changes to the skeletal when it comes to activities and environment? So that is where the origin insertions of the muscles comes importance, and we can do scorings for that. And last but not least, forensic anthropology, where the forensic anthropologists or some of them are the bioarchaeologists also can identify the biological profile, which means the sex, the age at death, and the population affinities, and also the stature. Yeah, so these are some of the identifications of the human that has been done by analyzing the bones, and of course some trauma and disease directly from the human skeletal remains as well. So just to give an overall, a very brief view on what is forensic anthropology. Let's say someone found this bone somewhere. Okay, so these are some of the questions that being asked, but I put it in a very simple way, whether or not this is bone or non-bone. So very obvious, this is a bone. So if this is a bone, this is the animal bones or human bones. So that is where we have to do some simple analysis to see whether it's human bone or animal bone, and that is where the anatomy knowledge is extremely important. So male or female, so based on these features, we have the skeletal A and B. So where can we distinguish whether male or females? So by gross features, we can say that A is a male and B is a female. Of course, there are some morphological traits that we can see. Yeah, it looks the same, but actually it's still different. Yeah, whether it's adult or sub-adult. So we are looking into the sutures, morphometrics, and measurements and features to categorize them. Asians and Caucasians, we have a very simple example. We can look into the mid-face. If it's a broader, so it's more tendency to African. If it's smaller and narrower compared to the width of the orbital, so it's mainly tendency to the Asians. Any disease traumas, we are looking into symmetrical and also osteochondral changes to the muscles. So all these things are within the fields of the bioanthropology. Right, so these are commonly method used in the forensic human identifications. Number one, we have morphoscopic assessment, which means we are using visual to analyze. Like for example, this is a standardized Walker standards. Yeah, the name of the assessment is called Walker standards. So there are 5 traits. For example, we are looking into the supraorbital features, mastoid process, mental eminence, and nuchal crest. So these are some of the anatomical features that we see to distinguish the male or the female. But of course, there are some, and this is very dependent on the experience of the observer. Right, but then there is also prone for some biasness as well. And next one is morphometrics. We do measurements, okay, in terms of the length, angle, and also indexes. And those next we have geometry, morphometry. If morphometric we measure on the size, geometry, morphometric we measure on the shape. Yeah, we quantify the shape, and now we have the digital artificial intelligence. So all these we can measure using either the dry bones or the X-rays or the CT scans. Right, but then when I step back and look in terms of what we have and what we don't have in Malaysia, I think this is my personal opinion. I do think that we did lack of some in the field of bioanthropology. I think we are still lacking in terms of teaching, learning, and research, which is number one. I still think that we are lacking of contemporary and documented. Yeah, most importantly is documented skeletal collections. Yeah. So why do we need this? Because if we have this, we can see a wide range of anatomical variation actually for us to research and for teaching and learning purposes as well. But because of the religion, cultural restrictions, so this is one of our challenges in Malaysia. And yes, so this actually hinders some of the aspect of us to move forward as well. Yeah. And secondly, lack of training centers. That if you compare with overseas, they have a very specific center or research specific for anthropology. Yeah, so but then in Malaysia, we have a general one, but it's not a very specific one. So in case people want to do like sub-specialization, so this is one of the major challenges. And thirdly, I think there is still a gap between the anatomy role and in anthropologists. I would like to take a few examples where they are anatomists, but they involve in the role of anthropology, where they can accept and give their expert on opinion on the anthropology cases. Like for example, Dr. Desire from Africa, they are anatomists as well as anthropologists. Dr. Paso from Thailand, Dr. Robert Mann from Hawaii, and also Dr. Jin from America. So when it comes to Malaysia, can we extend the role of anatomists? So I look at all these. Yes, so the fire in me tells me that I think I need to go outside Malaysia and to gain extra knowledge and skills, and hopefully I can bring back something to Malaysia. So therefore I look into the whiteboard. So this whiteboard in front of me, yeah. I always tell myself that there's no growth in comfort zone, there's no comfort in growth zones. So if it doesn't challenge you, it doesn't change you. So I think it's time, like I evaluate myself. Okay, so during when I were doing all this traveling, so I was almost at the end of my early career duration. So it's time for me to start up and have my professional development training out of Malaysia. So therefore, I have screened through around, looked through, read papers. I decided to go to these three different places. So Australia, Italy, Thailand is on my top three list. And when I visited these three countries, I set my vision, mission, and what I wanted to achieve. And this is what I wanted to do. So firstly, I would like to share my experience from Australia. So therefore, I went to Centre of Forensic Anthropology at the University of Western Australia. So I was invited as a visiting research fellow, and I was there for a certain durations of time. And yes, so when I was there, so these are the people I really want to meet because I read a lot of their papers. So Prof. Daniel Franklin, very prominent, prolific forensic anthropologist, Dr. Ambikas. Yeah, so and then we have the Dr. Zuzana as well. So yeah, so this is where I work in Australia, and this is the lab that I oftenly go, yes, to see. So what is my aim in Australia? So this is my ultimate number one, the most important aim, yes, to do a high impact research in forensic anthropology. So that is why I want to go there. Yeah. So what do we mean by high impact? High impact means we want something that at the end is transferable, usable for our stakeholders. We want something that can publish in Q1, Q2. We want something useful. And this comes with advanced statistical analysis, new research framework, new research culture, and international collaboration as well. So I went there. I unlearn everything. I relearn everything. I follow their protocols, follow their footsteps. I have a lot of engaging discussions with them that really changed my mind on how I look into forensic anthropology research. And I also joined their research bites. So they have a lot of research activities there, and I took opportunity to join. And I have quite a lot of discussion with this Dr. Susanna here. Dr. Susanna has two PhD, one in anthropology, one is statistics. Yeah, so a lot of things that I discuss should be applicable for the field of forensic anthropology. Yes, and then because they have limited skeletal collections, I use a lot of radiological approach for my research. So I brought my data. I have my radiograph, I have my CT scans, and that is where I do my work here. Of course, the paper is yet to be published. Yeah, we are still in the phase of that one. So hopefully I have something to show like in years to come. Yeah. So this is my first aim. Now, secondly, I want to expose to my PG postgraduate anthropology programs. Like explains, we don't have a specific program here in forensic anthropology. So I want to see how they run the programs. So they have quite a number of master and PhD students from all over the world going there doing a master and PhD in forensic anthropologists. I attend all most of their lectures and practicals to see, and I have the whole flow on how they really runs the programs. Of course, the way they teach osteology and the way we anatomists teach osteology is different, but there are some similarity, there are some differences, and I can see that there are things that they can be bring over and change the way on how we teach the osteology as well. And they have a very great facilities and teaching tools. So this is something that we don't have. So they look at these bones. So these are the color changes of the bones when they're exposed to different temperatures. So this actually relate to cases like trauma, probably, war where certain human remains are being burned. So we can see so from the color changes, we can say we can know at what temperatures they are exposed to in terms to fire. And here, these are actually the skeletal remains. So most of the times when we see the bones, we don't see in a very complete femur, complete skull. It's mostly fragmented. Yeah, so for example, these are the fragmented. So it's like a mini OSPE discussion kind of thing. So we see and identify how we can analyze the fragmented bone, which are actually quite difficult. They are, even for me, I find it challenging as well. So number three, I also wanted to explore the academic life in Western countries. I have my educations locally from my primary school to my tertiary educations. I don't really have a chance to, expose to academic life outside Malaysia. So this is my good chance. So I attended their orientation open day because it's the beginning of the semester. I never see people from so many countries before because they have booth representing each of the countries. It's actually their students' clubs. Yeah, so I think that this is a truly quite a huge international university where they can host so many. Yes, so this is UWA Toastmaster, yeah, a platform for people to train in public speakings. And I attended their some of their staff activities as well. So this is the academic staff appreciation lunch where they give awards to people who are prolific and outstanding. So I can see that there are differences in culture, very less on the protocol, very casual, no photographers, everything finished in 30 minutes. Yeah, so I can see that there are differences approach and how they carry out their activities as the academicians. Yeah, so this is, I also try to live like Australia. Rice is very expensive there, so this is what I eat. Sorry, I know it's Bulan Puasa, just to show that. Yeah, so this is what I eat, not much of rice, a lot of wraps, a lot of breads. Yeah, and then they like to go to park and eat. So I also join how they live their life. Yeah, so I have changes in my lifestyle. They love cycling there, and they have a very good route on the cycling. So yeah, I try to live like them. So I think it's a very good experience. But there are some Asian in me that remain unchanged. I go everywhere with umbrella because the UV there is so high in index, and I still work day and night because as much because I also wanted to finish what I started there. Yeah, so that's all my journey in Australia. So I did fulfill what I want. I did achieve my aim, which is very much focused on research and also the flow of the program and teaching and learnings. But then there are still something missing, which is skill experience in the real field settings. Yes, whether or not I can see bones and do the real analysis of what I have learned exposed for the past 5 to 6 years and apply it at the real bone at the real setting. So therefore, I find all over and I decided to travel to Italy. And so this is where I involved in one of the bioarchaeology projects. So this is where I went. I went to Venice. Venice is actually a water city. Yes, so there's no car in that city. It's all traveled by either by boats or by walking. Yes, so I went to this isolated island. It's really isolated, yeah. Yeah, no one live there. It's only mosquito and bugs live there. Yes, so this place is called Lazaretto Novo. It's actually a quarantine island. Just to flashback some of the histories. Yes, so last time when people wanted to land in Venice, they need to go to this quarantine island, especially they detected some of the ship where they have exposed to some disease or outbreak. So this is their quarantine islands. Yes, but after that, they changed this quarantine island to military island as well. And of course, now they have completely closed down the entire islands until few years ago, they started to expand the islands. And where they dig, when they do renovations and when they dig, they suddenly found a piles of bones and of course some archaeological things. So they started to invite experts to look into these bones and to analyze these bones. So this is how the project is started. And yes, as they dig, they found a lot of mass grave. Yes. So because if you relate many years ago, anyone that died from the disease, they just dump the body into the graveyard. So it's like one body stacked on top of each other's. So the process of excavation is very difficult. So we have to take a boat there. So this is how we landed at the so-called the isolated and quarantine islands. Yes, so this is where we live, very simple, very back to basics. There's very poor Wi-Fi connections. There's a lot of mosquito, bugs, spider webs. Yes, all this. There's no fans, there's no aircon. Yes, and it's quite hot at that time as well. So this is how the island look like. So this is where it stores all the bones and also archaeological sites. So we went to all this white color basket is all the piles of bones, which they have excavated earlier. Yeah. So this is what the process of what we did then. So yeah, exhumations is a process of digging out the bones in a by following a certain procedure. So this process is called as exhumations, which has been done. So they have been documented as well. And so all these bones are covered by mud. Okay, so next things that we have to do is we have to do the washing and identifications. What I do mean by identification here is we have to know whether the bones, whatever things they cover by bone, whether they are bone or non-bone. If it's a bone, sometimes it does mix with animal bones. So this is why when we need to isolate just purely a human bones. Okay, and there's a specific way on how we should wash the bone as well. And then we do dry, and the bones are very precious. We don't dry them directly under the sun. It has to be shaded in a way, yeah. So the next one, we lay down the skeleton in anatomical positions. Like me being anatomist, although I'm not very experienced yet, but I do have some very basic grounds on osteologies. But for me to lay down a skeleton in anatomic position does have some challenges because they are all fragmented. Like for example, the skull, whether we pick up a long bone, probably it's just the shaft. Yes. So we have to know this shaft, whether it's right or left. Which shaft does it belongs to? Does it belongs to humerus or the femur? And if we pick up that, does it belongs to the same individual? Because sometimes we have like, oh, we have 5 shafts. Okay, which of them are belongs to the same individual? So these are some of the challenges, and this is where I realized that the knowledge of osteological anatomy is extremely important, and they are very knowledgeable in that. Yes. So this is another example. I received a skull, and the skulls are very fragmented. So based on all these small little pieces, are we able to tell which part of the skull it belongs to? Yes, can be. So they are very knowledgeable because they pick up, they say, oh, this is part of the petrous bone. I was like, okay, I have to look at that properly again first. Yeah. So after a while, we managed to get a hang of that. And this is where we do a reconstructions of the skulls. So this actually takes me hours to reconstruct the birds because when to analysis, want to patch back as much as possible. Yeah, so this is me patching up, and at last we managed to preserve as much pieces in the skull as much as possible. And next one, we are doing analysis. When it comes to skeletal analysis, this is very skill and knowledge based as well. So there are many methods and standards, and we are the one that decides which one to follow. Yeah, so this is one of the case that I think is very interesting. So the first one we lay down the skeletons, and now we are looking at the medial end of the clavicle. So you can see here, yes. So at first I thought this is a fragmented medial end of the clavicle, but actually this is the unfused medial end of the clavicle. Unfused medial end. So what does that mean? So we have to go back to our developmental osteologies. Yes. So the clavicle actually fused at the age of around 20. So from there, we know that this should not go beyond 20. But at which range is that? Yeah. So then we have to look into other skeletal element. So this is one of the vertebra, and we can see that this line here. So this is actually, okay, okay, so we can see here. Okay, so this line here is actually what we call by billowing. So this represents a juvenile vertebra. So most likely it's about 17 to 18. So there is another clue that we have. The next one, we can see this right here. So this is what we call by small nodes. This is very common. It's an asymptomatic spinal conditions of the intervertebral disc protruded at the end plates. So we know that, okay, this individual probably have some spinal issue. Okay, so then we look into the mandible. So if this is a juvenile, we don't do sex estimation. We mainly look into the age and also what you can see. So we can see that here we have quite a lot of callus formation. So this callus formation actually shows that this is a hardened plaque, so hygiene is not so good, probably because these bones are 500 years ago. So we question their hygiene and overcrowding of the bones. And then we also can see that, okay, so this is a slit at the end. This is slit sternum. Yeah, we are still unsure why there is a slit there. Okay, yeah, so this is actually a congenital abnormalities, and we look into one of the long bones. There are signs of heel fracture, but it's still alignment. And interestingly, when we try to reconstruct the pelvis, we can see that there is a lot of misalignments of the pelvis. The right ox costa and the left is not different. And that explains why there are differences in the leg length throughout the whole lower limb. And even for the upper limb, there are also differences in terms of the size. So probably that also explains why there are changes in the vertebral column as well. So yeah, so these are some of the informations that we have. Another interesting case we see is actually a child, a small child. So when I put this into the anatomical position, I have issue as well, because all these small bones, to me, I am not too sure whether they are the body of the vertebra or they are the couple bones. You know, all these look the same, but they are still differences. So we open up our juvenile books, not a juvenile books, our osteology in children books. So we have to look into, so I just want to highlight, this is actually a dance, okay, of the C2. So dance in the adult and at the children is totally different. And that is where I managed to put it into position. And these are not fracture, these are actually the unfused C2. All right, and these are some of the analysis notes that I make. So I analyze vertebra by vertebra and all the skeletal elements just to know at what age these skeletals belongs to. So at the end of the analysis, it is surely analyze all the bones. So this is less than 2 years old. At the end, this is about 1.5 years old, and we have to arrange that into anatomical positions. So if you can see all these skeletal elements, you can see that yes, we know that, we have more bones in children compared to adults. And now we see it in front of our eyes, and that makes a huge difference. Yes, and of course, this is just highlighted some of the cases, and at the end, we need to do a proper documentation. There are ways to do that, and we documented by photographing, 3D scanners, and we pack back into the individual bags for the future use as well. And these are some of the osteological books that I frequently read and refers to that actually enhanced my knowledge in osteology as well. And these are some of the tools that is being used for the bioarchaeological project, which is very interesting in a way. So we worked throughout even during the weekends, okay? But when we have some times, we did take like a short half day of only on the Sunday. We just walk around the towns, and yeah, so we are happy we managed to complete the whole projects. Yeah, we stay near to a month in that isolated islands. Yeah. So, so now in the Australia, I managed to get a good exposure in terms of research and also the flowings of the programs. Italy, I got experience and the exposures in seeing the bones in the real settings. And next, I would like to travel to Thailand because these are our brothers and sisters countries. And I would like to expand in the Thailands. They also have bones, and I would like to see how they expand further in terms of the networkings. So in Thailand, I managed to meet, this is another anthropologist that I really wanted to meet so much. So this is Professor Dr. Mann. So he is the one that wrote these textbooks that a lot of people refer to. So we can see that, you see, he has already documented all the non-metric traits, which means variations. Anatomical variation is all the human skeletons. So he did involve in all the walls. He is also involved in analysis the bones from the 911 attack as well in US. Yes. So here I am. I'm at the Siraj Anatomical and Anthropology Bone Research Centers. So he is actually the visiting professors in Mahido universities. So I did have some professional networkings with the team in Mahido, together with the director of the center, Dr. Napakon Sangchais, and together with the team. And I do meet with a lot of others. We have bioarchaeologists, we have anthropologists or osteologists from all over Thailand. Yeah. So next one, I also involved as a facilitator in the osteological workshop with the medical students. So there in Thailand, they do have an osteological workshop in medical students. And yes, and I am quite amazed with how well they retain the knowledge in osteological there, because they even can identify the right and left metacarpal and also phalanges. They also know how to differentiate right and left carpal bones. Yes, which I only know it when I went to Australia and Italy as well. They lie down, they also know they are also exposed to anatomical variations. So I think this is some of the plus points of Thailand, where they are, because I think they are very good. They have a very huge body, the osteological collections, so they are able to do all this. Yes. So I also was invited to speak, to give a special lectures on what we have done in Malaysia. So that actually built like our initial international networking as well. So we do case by case. We do a lot of case study with Professor Dr. Mann. Actually, these cases is another forensic anthropology cases. These are actually they are in Thailand. They are expanding one area where they wanted to build a LRT, but as they dig out, they found the whole trash of human bones. So there are archaeologists who excavate the bones and they send to these anatomical and bone research centers for further analysis. So I go through the case by case with Dr. Robert Mann, where I also learn quite a lot from him as well. So sometimes we have like, all the femur there. Sometimes we have like other than the cases, we also have some learning sessions. So we have like femur there, and we also have the pelvic days. So now we're exposed to different methods, like for example, Suchi Brooks methods, the Suchi Brooks methods for age estimations. This is Suchi Brooks, yeah. Using the pelvic symphysis, we can actually know the age of the individuals. We also see the Phoenix methods, that is to identify the sexings. So we use like a ventral arch, subpubic concavity, and the ischial ramus to analyze the sex from the pelvic itself, because sometimes we only found half of the pelvis, like as been said as well. So I also exposed to the body donations and medical museum. I've been to medical museum in so many countries, and I think that Thailand has the best medical museum because I never see such a huge collections of conjoined twins. There's also another anatomies that manage to dissect lymphatic system. There's the one body, just the lymphatic system, where I'm really amazed with that. Yes, I also amazed with how they run the body donation program. Yes, so that is why they are very skillful in surgical anatomies. All the medical students need to do dissections. Yes, osteology as well. All the medical students are exposed to bones. They also do research on bone as well. Yes, and these are all the three visitings scholar. Yeah, me, and we have Dr. Professor Man and Dr. Stipon, and from Chiang University. So this is where we managed to collab in various manners as well. So just to share some of the interesting cases that we managed to see here, which I find it interesting. So this is the mandible and also the base of the skull. So you can see here there is some small protrusion, some extra bony things. So actually this is what we call by torus mandibularis, because this is at the mandible, and another one we call as torus platinisus. So this is actually this is actually not a tooth, yeah. So this is actually a extra bone growth. Okay, so this actually can appear at the one side on or this actually usually appears smooth and also rounded, yeah. So another thing actually we see here, this is actually based on the skull. We can see the hygiene of the bones. And one more thing, yeah. So we can see this one. So this is what we call by Pachyonychia. So this is actually see through the foramen magnum. So this is actually caused by the arachnoid granulations. So something that I never see as well. And extra things to see. Can you see this one? Can you see that this one, the styloid process is very extremely long? So anything that is above 3 cm, so this is more prone towards the eagle syndrome. Yeah, so that is something that we can analyze from the bones. Next one, you can see that this is the sternum. So you can see that usually this is our costal cartilage. But here in the case here, this costal cartilage is being ossified. So this is actually age-related hardenings of the connective tissues. So this is more prone for women over 50. And here we can see child osteology is very rare to see, but they have quite a near to complete bones. And here we can see the ossification center of the sternum as well as other features like underdeveloped mandibles and extra sutures of the skull as well. So this is some of my reflections that after being to these three countries. So this is some of my reflections. I felt that skills and knowledge is something that we have to invest at certain phase of our career. I received some funding for when I went to Australia for my sabbatical, but some of the funding comes from me myself, because a lot of people ask me like, whether I fully cover and all these things. But to me, nothing's come easy, nothing's come free. If you want to look for opportunity, if you want opportunity, we have to hunt for it. Yes, and I think that after all these experiences, I never looked the bone at the same way again. I did teach osteology in UITM. I think I teach in a very different manner now. And when I design the research framework for my new PhD students, I design it very different now. And I think I also look at the way on how they build the relationship and also coach their postgraduate students. It also changed me in another way. So I hope that is for the betterment. And next reflection is from all this knowledge and skills, how can I contribute back to Malaysia? Because I think that skills and knowledge, it has to be shared, and we have to do something so that it uplifts the anthropology teaching, learning, and research in Malaysia. So I think that so this is one of the things that I try to do. So I try to bring benefits to MA and anatomists in Malaysia. So last year we had the workshop. We have a forensic anthropology pre-conference workshop where we have people from all over the world, and we also have invited speakers from Thailand as well. And this actually opened the mind of a lot of anatomists, because we received immediate feedback saying that I never look osteology the same way again. I never thought that osteology can be taught in this way. I never thought that clinical osteology and applied osteology or anthropology can be delivered in these manners. And this also highlights the potential of a lot of our Malaysian anatomists because they are also being invited as a facilitators. Yeah. So this gives us and everyone an opportunity to learn together. And there are also some transfer of knowledge and skills. So we started to have keynote speakers, Prof. Daniel Franklin, which specializes in forensic anthro. And we have also had symposium speakers from Thailand, Indonesia, and also Hong Kong. And next one, these skills and knowledge, I also try to bring it to the universities. I have a matching grants. It's called as International Strategic Research Partnership Grant, and I managed to got it as main PI. So I have a collaborations in Indonesia, MOA signed, and we're going to have two PhD students that are going to carry out these projects. And with Thailand, we have one PhD students incoming along the way, and we wanted to do like student exchange project and exchange of expertise because I think we are all have different strengths and it's best for us to exchange the expertise. And I try to bring some benefits to the Department of Anatomy as well. So this is where we managed to host a bone defleshing workshops. So in order to do a bone preservations, let's say we receive a body, let's say we decided to do a bone preservations. There's actually many ways on how we can preserve a bones. Okay, so other than buried under the sand, we can do chemical methods, we can do boiling methods, and we can do insects methods. So total, there are actually 4 methods on how we can do a bone defleshings, yeah, to preserve the bones. Yeah, of course, all these come with pro and cons. So I also, last but not least, I would like to also quickly share the team efforts. Yeah, so all these are team efforts, our journey of forensic anthropology through the lens of radiology. So number one is we have to also develop a morphoscopic sex estimation through the CT scans. A lot of the people says that, you know, when we use the dry skull, we can see, we can touch, we can feel. But how about CT scans? Because we don't have a collections in Malaysia. So but yes, we also can manage to develop a method so that we can do the same way with the CT scans. Then we have also did a morphometrics approaches. So we also do internal evaluations. So this is Damia's projects. Yes, so we look into the patterns, linear measurements, volume, color-based bone mass, geometry, morphometry. So we have to develop a multimodal approach for the frontal sinus. That is one of the examples. Yes, yes. So next one, this is some of the research awards that we managed to get together with our students. Okay, so we also have some other internal evaluations. So this is very carried out by the Master of Forensic pathology students as well as elective students as well. So we also did extracranial evaluation, and also we managed to do the soft tissue measurement for craniofacial reconstructions as well. And next one, we also looking into artificial intelligence. Okay, we did develop a AI prototype following the TRL. So this is hopefully that in the future we can do something that can assist the anthropologist teams. So these are some of the research output. So I managed to get some research grant, international grant, national grant as a project leaders, and some of them are actually the internal grants. Okay, so these are some of our list of publications. So we also try to expand our projects beyond research and also publications. So we participate in various types of innovations competitions, because at the end of the day, we don't want the research just to stop at the level of publications. We want it to known by the public. We want it to be applicable. So that is why we take part in the innovation competitions. And in one of the innovation competition, we won ourselves a special innovation award. And even the Minister of Terengganu visited our booth and know more about our projects. So this is some other award as well, gold awards. And we also formed the industrial collaborations where we have an exchange of the resources. So these are some of the memorandum of collaborations that we have signed with our industrial partners. So we also filed our copyrights. And last but not least, I would like to send my appreciations to all the PhD students. They are doing PhD and masters using various different type of bones and using various model as well. Yes, and yeah, so the last one to the most recently graduate is Dr. Rani, and yeah. So yes, I also would like to give my credits to all my national and international collaborators. So I think it's good for us to cross collab with various type of expertise forensic anthropology scientists, anatomists, odontologists, pathologists, radiologists, AI, and also the engineers. So this is where we can excel the most. Yeah. So thank you so much for your intentions. Yeah. So I welcome any questions from the floor.
Thank you so much, Dr. Choi. That's a very, very interesting and insightful experience. And I believe there will be many questions from the floor. But to begin with, me myself, I want to ask you one question. In Malaysia, how can anatomists contribute to forensic anthropology? I mean, in the field itself.
Okay, so thank you so much, Dr. Hida, for the questions. I think that is a very relevant question. So how can we contribute to the field of anthropologists? So number one, I think we have to look into what we are lacking of. So we are actually lacking of database. So currently, if you look into the assessment form by the anthropologists, they are still using the standards or the formula or the methods that is developed for overseas. Okay, so which means, like for example, the stature estimation, the height, they are using the foreign one. Okay, we want to see the exact estimation they are using a foreign one. So there's no one, we don't have a complete database for Malaysia. So for now, I think we have to first enhance on our research first. We have to build our own database so that we can really present it. This is the evidence-based regressions formula that can be used for the Malaysians. Yeah, because if you use, like for example, we are Asian, we are smaller in size. If you use other people's methods, we will be different because we know that the Caucasians, they are taller, bigger size than us. Yeah, so that's number one we can do. Number two is I think we also have to enhance on the skills and also the knowledge, because so that whatever things that we formulate and frame and designs is actually cater for the needs of the anthropologists. So I think that if we can, I think we are moving towards the right directions, because even among the anatomists, we have more and more PhD students building up the database. But of course, we are still, it's a long way to go some more, but I think we are moving at the right directions.
Yeah, all right, all right. I believe there will be one big data that can be referred by Malaysian forensic anthropologists one day. Okay, thank you, Dr. Choi. Actually, there is one question from Dr. Rani. Congratulations, Dr. Rani, for your recent PhD Viva. Okay, her question is, may I know why we can't dry the bones under the direct sun?
Yes. Oh, thank you so much. Yeah. So this is also another good question. There's a few reasons. Yeah. For number one is because when we wash the bone, it's at the lower temperatures. So when we expose the sun under the direct sun, is at the higher temperature. So because of the differences in the temperature, so they are prone that the direct exposure to the sunlight will crack the bone further. So this is a post excavations breakage. Yes, so that is something that we don't want. Yes. So number two is direct sun will causes more bleachings to the bones. Because when we analyze the bones, we also look into the aspects of the taphonomy. Taphonomy means we look into the changes of the environment. What is the fact? How the environment causes the changes to the bones. And one of the things that we observe is actually the colors. Yes, if you have the bones that is being exposed to direct sunlight, it will causes bleaching. So the bones that is, yes, exposed to direct sunlight is more white compared to the bones that is being dried in a more natural environment.
All right, thank you. Thank you, Dr. Choi. And now I open the floor. If you have any question, please unmute yourself. Okay, Dr. Siti.
All right, thank you, Dr. Ida. Thank you so much, Dr. Choi, for very impressive and inspiring presentation. Your academic journey is really mind-blowing to me, especially at a very relatively young age in your academic career. And actually, I particularly like the point that you mentioned that you unlearn and then relearn everything, which I think not many people are willing or ready to do that. So I'm wondering how you began to unlearn certain things and to prepare yourself to relearn. And for young academicians, I believe it's me as well. When I was a young academician, I found it's very challenging, to build strong international networking. So based on your experience, you have a very strong international networking. So based on your experience, what advice would you give to us, especially, sorry, telefon pula, to younger generation, okay, on how to strategize their career? I think that's all. Thank you.
All right. Thank you so much, Dr. Siti, for your questions. So let me answer the first questions. So how do I unlearn and relearn? So I think the first thing is we have to set our mindset, because when I went for sabbatical leave, when I went to all these countries, of course, we don't go, we have our prior experience and knowledge before we went to these places. Yes, I think we have to know in mind that we are not the best, and the why we want to go to these places. So we have to set our vision and mission very clearly. So these are the things that I want to explore. These are the things that I want to learn. So it's very important for us to unlearn first, so that we can accept the new things that they have developed and it has been proven to be high impacts. So I think the first thing is we have to set our mindset. Yeah. Yes, because I do not want to go there showing that I know everything, because knowing me deeply as much, the more I read, the more I think that I do not know a lot of things. And the more I do not know a lot of things, though that is where we need to unlearn and relearn, especially from the experts. Yeah, so I think we have to set our mindset correctly. And yeah, it's not easy to do so, because we tend to wanted to show what we have done, and we wanted to show that we know something. But I think it's good sometimes we take a step forward, but when at the right time, we also can take our step forward. So we have to have a balance between what we should unlearn, what we should relearn, when we should take a step backwards, and when we can be very visible and take a step forward and to show what we have known. Yeah, so I think this one comes with try and error, and I think this one does comes with who we are and where we go. Yes. So coming to the second questions about the international networkings. So this is when I begin my career, and even until now, I also still consult mentors on how we do the international networkings. So I think number one, the most important thing is I think we have to actively attend conference locally and internationally in the field of anatomy, and also in the field of your niche areas. And when we go to conference, we just don't attend the lectures, or we just don't attend the lectures. I think prior attending to the conference, we read through the speaker's profile. We make up in mind who we want to meet. When we meet the person, we also try to pitch whatever things that we can do, and we also build a relations from there, because we are meeting face to face, and that is a rare opportunities. So I think MAA, we often have a conference every 2 years, and that is actually a good platform to begin with. And we often hope that everyone be very active in all the activities by the Malaysian and Anatomical Associations, because international networking sometimes comes from the national networking as well. So I think we have to cater both. And number two is I think we have to be visible. I think whatever things that we have done before, I think it's good for us to be visible to people. So we have to be very clear what is our niche. Okay, we can use a lot of social media platform to portray what we have done. Okay, from the team, and also I mean what are the niche area that we have. Yeah, so I think that this is my two tips to all the anatomists here.
Thank you, Dr. Choi. I hope this will inspire young anatomists to be as active as you, and to be inspiring others as well. And Dr. Choi, okay, this is my question. You said that you're no longer looking osteology as like you do before your training. So I wonder how you look into the osteology now.
Okay, I think that's also very relevant questions, because I think that whatever experience that I have, I try to put it back into my teaching and learning as well. So number one is siding. So one of the things that we often teach students is do the sidings, how to differentiate the right and left. Actually, because for the anthropologists, we need to do a quick siding right and left for all the bones that they have. So they have a certain recipe, tips and tricks on how they can differentiate the sidings, right? So for example, the lower end of the femur, I don't have the picture to show, but actually like the lower end of the femur, like let's say we also can see that there's like actually an L where the angle is pointing is actually towards the side of the bone. So there's a very quick way, tips and tricks. Because often when we teach, like for example, scapula, we often say like, okay, this bone is superiorly orientated, this region is medially orientated, okay, the spine of the scapula is posteriorly orientated. Yeah, so this one is a bit theoretical, but where they do their sightings is often like tips and tricks. So I find it very fun. Yes, so I think that is something that I try to do differently with my students now. And number two is in terms of clinical anatomies. Yes, when we look into the SLO, like actually UITM, we have one called forensic osteology as one of the SLO. Yes, forensic osteology, like, yeah, like how we can apply the forensic. Yeah, so now I have all this, like previously it's very much theoretical in delivery, but now I have more pictures, I have more experience, and I think it's more relevant to them. And especially when I show them some of the pictures, the cases, I think they can make it more relevant on why we should study osteology in application for forensic, because forensic osteology is under the arm of forensic medicine. Okay, if they want to become a forensic pathologist in the futures. And number three is when the students have elective projects, I also involve them in the bone project as well. So that actually expose them not only on osteology, but the whole forensic medicine field as well. So actually that actually increased their interest in osteology as well.
Okay, all right. Okay, thanks, Dr. Choi. And I think you can publish on how the tips and trick on identifying the bones one day.
Yes,
Okay,
hopefully. Yeah.
yeah. So anybody on the floor, if you have any question, last one. Please unmute yourself. If there is no more question, Dr. Choi, thank you so much for sharing your valuable knowledge and experience